we've been watching the wave, the tsunami for mental health and addictions issues that is overarching the waves of COVID-19.
Announcing a $12 million investment in support of mental health treatment, the Associate Minister of Mental Health and Addictions says the pandemic has caused more cases of anxiety and depression and more substance use.
It's evident and it's clear there is an increase in use of substances, including alcohol, and it is a concern.
Can't go to work, so what are you going to do? Watch TV and drink?
Mike Nelligan says he wasn't much of a drinker before the pandemic, but now he drinks a 26er of rum every couple of days. He lost his job as a truck driver because of COVID and is feeling the stress and isolation.
It all adds up to me wanting to have a drink.
Laker Ice and Budweiser.
Jeff Hallett says he's buying more alcohol, now heading to the beer store several times a week, when before it was once.
I already came to the realization that I was drinking too much, so I kind of set myself with limits.
Andrea Satimi says she too has been drinking more than usual, so she decided to give up alcohol for January. She doesn't think the extra drinks were due to stress or isolation.
It was more so a social thing with chatting with friends on the computer.
I have a hard time being alone, and it's been something that's driven me to picking up drugs many, many times.
Hillary Schroeder is a recovering opioid addict who just celebrated 1 year sober. She got out of rehab just before the pandemic began and says the isolation, while hard, has helped her stay clean.
I haven't really been able to venture out and get myself into trouble.
But it's meant she's had to adapt to accessing recovery meetings and resources online.
It was hard not having the human connection.
A national survey by the Canadian Mental Health Association found the second wave of the pandemic has intensified feelings of stress and anxiety, with only 1 in 5 people feeling hopeful right now. CMHA's Peter Blomendahl says substance use is up too.
Certainly anecdotally, we hear from all of our departments, people are struggling. They're struggling with kind of a loss of a lifestyle that they used to have.
Blomendahl says some of the largest risk factors for substance use is boredom and coping, and unfortunately few Canadians are getting the mental services and supports they need. Matt Ingram, CHCH News, Hamilton.